It's my pleasure to first introduce Dr. Kristin Hoffman. She is our Director of Trauma Psychology here at JohnsHopkinsAllChildren's. She specializes in program development, assessment and treatment of childhood traumatic stress and child disruptive behavior disorders, dissemination of evidence-based practices for childhood trauma, and development of trauma-informed child welfare systems. Her research interests include evaluation of factors impacting use and effectiveness of trauma-informed programs and interventions. Welcome, Dr. Hoffman.
Oh, thank you. Haven't even done anything yet. Okay, so for the next 15 minutes or so, I am going to talk about the impact of traumatic events on children as well as parents, and what to do and say to your children in the aftermath of tragedies such as the shooting in Parkland. Unfortunately, in today's world, it's not always possible to shield our children from tragedies, disasters, and other traumas that occur, no matter how hard as parents we work to keep our kids safe. Children may not personally experience these types of events firsthand, but they are being exposed to them through media, through other people, and even at schools where kids as young as 4 and 5 are having active shooter drills. It's just unbelievable. Being a parent myself, I know it's impossible not to be worried about our kids when they're away from us. So it's totally normal and natural following events like Parkland to be worried as a parent, to be anxious about sending your kids back to school and kind of disheartened about the violence that's going on in the world. As a psychologist who specializes in working with children who have experienced trauma, my first piece of advice to caregivers and parents is usually take care of yourself so that you can take care of your children. Our kids, no matter how old they are, typically go to parents in times of stress. Young kids and even older kids are looking to their parents when traumatic events happen or things that are uncertain happen. They're looking at their parents' reactions to try and figure out how they should be reacting. So because they often mirror their parents' reactions and demeanor, that means that us as parents have to be very good models of how to manage stress and manage our anxiety following these types of events. So as a parent, when you first hear about these tragedies, try and have your first initial responses of shock or helplessness or whatever emotions you're going through, try and have those away from your children if at all possible. It's okay to show our children emotions, but we don't want them necessarily seeing those really intense emotions from us. So my advice is initially have those away from them. Give yourself some time to process your feelings. Reach out to your support system so that you can be calm and regulated when you talk with your children. We're lucky that later tonight, Dr. Katzenstein is going to talk to us about how to manage our anxieties as parents so that we can be healthy and present for our kids when we have to discuss difficult topics. When the world around us is dangerous or unpredictable, home really needs to be the safe haven for people. So in the aftermath of tragedies, it's important to keep schedules, routines, and typical family events that you usually would have. Those kind of restore some sense of security and normalcy. As parents, try and spend more time with your kids in the aftermath of tragic events. That builds just great relationships, but it also gives them more opportunity to ask questions and open up. Talking to children about their worries and concerns is really the first step in helping them cope with events that are going on and helping them to feel safe. So what you say and how you say it definitely matters, given kids' age and developmental level. So 7 and 8-year-olds don't need to know things in the same way that 16 and 17-year-olds do. So next I'm going to go through different kind of developmental stages and give you some ideas about how to talk to kids of different ages. For our preschoolers, so generally between the ages of 2 and 5, they don't necessarily need to know about these types of events going on if they're not going to hear about it otherwise. They really don't. So at that age, they should be focusing on stranger danger and personal safety types of things, and introducing all these other possible traumatic events that happen in the world may scare them unnecessarily. Obviously, if your preschooler has heard about these types of events or is at risk for hearing about them, talk to them. I'm not saying don't, but if they're at risk, definitely talk to them. But with preschoolers, you want to keep what you say very simple and limit it to about 1 or 2 sentences. So, for example, in relation to the Parkland shooting, you could say something like, a very bad man felt very angry and hurt some people. It's likely that preschoolers are going to be very confused as to why someone would hurt all those people. And so it's okay to talk to them about how this bad man is caught by the police and locked up and can't hurt anybody else right now. And I always tell parents to try to counteract these negative emotions and discussions with more positive ones. So with a preschooler, I would probably then go on and say, but did you hear about all of those really brave policemen and teachers that rush to keep kids safe? Let's talk about those and what those professionals do. Children 6 and up are more likely to have heard about events that have happened from their friends, from social media, from all different types of sources. So definitely go and have a conversation with your older kids if they're not bringing it up to you. If we don't talk to our kids about these things happening in the world or difficult events, they may let their imaginations run wild and overestimate or over-dramatize what's happening. On the other hand, they may also get the message that these are things we shouldn't talk about or that you don't know what's going on in the world, and that's definitely not what we want our kids thinking. It's always a good idea to practice in your head ahead of time what you want to say to your children, or practice with someone else, like a partner or a friend, so that you're very clear in the message you want to send your kids. Think about what you want your kids to take away from the conversation and try and focus your discussions with them on that. For kids that are between the ages of about 6 and 12, so our school-age kids, you definitely want to go and have a conversation with them about these tough events. And you could approach them by saying, did you hear about that shooting that happened at that school in Florida? What do you know? What questions do you have? For school-age children, we really want them to be leading the conversation with their questions, because then when we do that, they're kind of the gatekeepers of how much information they want to hear and what they're able to take in. So kind of follow your kids' lead. Letting them ask questions and be in charge also lets you know what they're thinking and can help you clear up any misbeliefs about what happened, such as the event's still going on or it happened right down the street. I will admit, when you let kids be in the lead and ask questions, they're probably going to ask you some difficult things, like, can this happen to me? Or can this happen to you at work? Or can this happen to my sister? In those instances, I would say just recognize that the underlying theme and message of those questions is usually, am I safe? So it's okay to talk to them about how these events are really rare, about how there's more good people out there in the world than there are bad, and how there's lots of people out there that are working to try and keep them safe. Also, I would say for kids this age, definitely point out or acknowledge and validate their feelings. So say things like, I understand how you're scared to go back to school. I'm a little worried too. Let's talk about what we can do to help you feel safe when you go back. For kids of all ages in the aftermath of tragedy, it's a good idea to limit their media exposure. What we see stays with us longer than what we hear. And there's research to show that repeated exposure to violent images, especially realistic images like that are being shown on news, can be damaging, more damaging. So we just want to limit that. And again, if they have seen something that's been disturbing to them, try and counteract those images with more positive ones. So show videos of helpers that came in and rescued people. So for our teenagers, you would approach a conversation in much the same way, but with them, you really want to know where they're getting their information and what their friends are saying. Go with them onto social media. Go with them to their Facebook pages, their Instagram, whatever else is. There's probably lots of other stuff out there I don't know about, but go with them to those pages and look at what they're looking at. Find out where they're getting their information. And that gives you an opportunity to clarify things, to ask about their thoughts and feelings. It's possible that our teenagers may express opinions that differ from our own as parents. And if they do, when events like this happen, things tend to get politically charged. If your teenager does express an opinion different than yours, it's okay. Just agree to disagree, move on. But we want to make sure that they feel comfortable going and talking to you. Teenagers, especially this current generation of teenagers, really tends to believe in social justice and collaboration. I think we're seeing that with those incredibly brave students from Marjorie Stoneman Douglas High School and their gun control efforts and rallies. They are getting involved and trying to make a difference. And those are all really good things for building resilience and helping kids cope after traumatic events. So if you feel like your child or your teenager really has been impacted by what's happened, help them get involved in community events. Help them get involved in charities so that they feel like they're making a difference, however you feel comfortable doing that. Despite our concerns as parents about the emotional impact of these types of events on kids, it's important to know that common reactions after tragedy usually diminish over time. So it's common when kids hear about these types of events happening to be a little bit more worried about their own safety or their parents' safety, to maybe have some trouble sleeping or eating, or to have more trouble concentrating in school. And we really would expect those types of symptoms to go down after a few weeks. If they don't, and you notice prolonged trouble with eating or sleeping, more somatic symptoms like headaches, stomach aches, more acting out behaviors or high-risk behaviors, more withdrawal from events and people that they used to enjoy, then it's probably a good idea to reach out to a mental health professional for more assessment and more help. And I would also say that if your child has personally experienced a trauma firsthand or has witnessed a trauma firsthand, there is really good help out there. And the sooner we get kids into the right services, the better outcomes we see. So where do we go from here? We are about 2 weeks out from the events that happened in Parkland, and many of you have probably already talked to your kids about what's happened. If you haven't, it's a great idea to go back and do so, especially if you have teenagers. But I would encourage our children in the future to report any signs or symptoms of anything concerning in friends or anything they see on social media. They need to be comfortable going to parents and other adults like teachers and talking about those things. Spending more time with our kids away from screens is a really great idea. Make sure that you as a family have a safety plan so you know what to do in case of an emergency and write that down. And especially with our younger children, telling them that when an emergency happens or something scary happens, that they need to listen to the people who are in charge and follow those directions. So my time is up. And I want to end on a hopeful message because this is some really difficult stuff. And here's my hopeful message. Hopefully it puts you at a little bit of comfort. So we may not be able to prevent bad things from happening to our kids, but with the right support from adults around them, most of them really end up being okay. Over time, most children really do go back. They bounce back, and they're pretty resilient, especially if they have loving, caring parents who spend their Monday nights coming to events like this to learn how to support them better. Thank you.